Gout isn't just a painful inconvenience, it's a form of inflammatory arthritis that can seriously impact your quality of life if left untreated. Caused by a buildup of uric acid crystals in the joints, gout typically strikes the big toe, but it can also affect other joints like the ankles, knees, or fingers. Let's break down what gout is, why it happens, and most importantly, how to prevent it from getting worse. What triggers gout? Gout flares up when there's too much uric acid in your blood. Uric acid is a natural waste product from breaking down substances called purines, which are found in many foods and drinks. When the body can't eliminate uric acid efficiently, it can form needle-like crystals in the joints, and that's when the pain begins. Here are some common culprits behind high uric acid levels. Purine-rich foods, think red meat, liver, and certain seafood like anchovies and sardines. Alcohol, especially beer and hard liquor, which can interfere with uric acid. Medications, diuretics often used for high blood pressure, can raise uric acid levels. Health conditions, kidney disease, obesity, high blood pressure, and psoriasis increase your risk. Family history, genetics can play a role. If gout runs in your family, your risk is higher. Spotting the symptoms. Gout often comes on suddenly and painfully. Watch for sharp, intense joint pain, often starting in the big toe swelling, redness and warmth in the joint, trouble moving the joint or putting weight on it. Diagnosing gout. If you suspect you have gout, your doctor may use the following tools: joint aspiration, drawing fluid from the swollen joint to check for uric crystals under a microscope. Blood tests. These measure uric acid levels and help rule out other conditions. X-rays. Imaging can help detect long-term joint damage or other forms of arthritis. The 4 stages of gout. 1. Asymptomatic hyperuricemia. Uric acid levels are high, but you don't feel any symptoms. This is your window of opportunity for prevention. 2. Acute gout attacks, sudden, excruciating pain in one or more joints. These flare-ups can last days or weeks. 3. Intercritical gout, the quiet period between attacks. Even though symptoms vanish, uric acid may still be silently damaging joints. 4. Chronic tophaceous gout, long-term damage develops. Uric acid crystals form lumps under the skin, tophi, and permanent joint damage may occur. Treating and preventing gout during an attack. Anti-inflammatory meds, NSAIDs, corticosteroids, colchicine. These help control pain and swelling quickly. Long-term management. Uric acid-lowering medications like allopurinol or febuxostat. Regular blood tests to monitor uric acid levels. Lifestyle adjustments. Lifestyle tips to reduce flares. Stick to a low purine diet, more fruits, veggies, and whole grains, less red meat and shellfish. Stay hydrated to help flush out uric acid. Limit alcohol, especially beer. Maintain a healthy weight, since obesity increases is more than a temporary inconvenience. It's a chronic condition that needs long-term management. The good news? With the right treatment and lifestyle changes,